When we see patients with prostate cancer, the prostate cancer can be either localized to the prostate or it can be spread to different parts of the body. And so when we make treatment plans to manage their prostate cancer, it's based on the risk and the sites of spread. But sometimes the behavior of the prostate cancer that's located in the prostate is considered high risk based on a high Gleason score, which is a description of what it looks like under the microscope, or it might spread to lymph nodes that are nearby or to other parts of the body. But if the sites of spread are limited to the lymph nodes or just maybe one or two sites in the body, we might be able to treat them aggressively with the intent to cure them. So a very common regimen that we'll use to treat these patients is to use 2 years of hormonal drugs involving a testosterone-lowering drug, which is most commonly Lupron or Eligard, in conjunction with a second drug, which is called abiraterone. The problem with 2 years of treatment with these injectable testosterone-lowering drugs is that oftentimes after completion of treatment, the testosterone actually never recovers all the way back to the normal range. And the problem is that chronically low testosterone levels not only lead to ongoing side effects of the treatment, so fatigue, hot flashes, weakness, things along those lines, but might also have some long-term risks, including risks to bone and muscle health, risks to cardiovascular health, and risks to neurocognitive and emotional health. And so what we tested in this particular study was that there were a subset of patients where we actually stopped the injections earlier than that 2 year time point. And what we found was that in the group that continued the testosterone lowering injections all the way out to the 2 years of treatment had a very low rate of testosterone recovery at 6 months and a year of only 15% and 39%. Whereas the patients who stopped the injections more than a year prior to stopping the abiraterone were able to maintain their testosterone at very low levels out to the completion of the 2 years. But the recovery of testosterone after completion of treatment was actually 82% by the 6 month time point, which is much, much faster and much more reliable than if you continue the injections all the way out to the end of 2 years.